Every year on July 23rd, we celebrate World Sjogren's Day in honor of the birthday of Dr. Henrik Sjogren, a Swedish ophthalmologist who discovered Sjogren syndrome. Sjogren's Foundation's report as many as 4 million Americans have Sjogren's disease, with an estimate of 2.5 million patients currently undiagnosed. Thus, it's critical to spread awareness about this life-altering disease. However, diagnosing someone with Sjogren's can take 2 years. About half of the time, Sjogren's occurs alone, and the other half it occurs in the presence of another autoimmune connective tissue disease such as rheumatoid arthritis or lupus, thus making it complex to diagnose. Also, there is no single test that will confirm the diagnosis of Sjogren's, and thus physicians must conduct a series of tests which includes a blood test, eye test, dental test, which may also include biopsy and more. So what is Sjogren syndrome? Sjogren syndrome is a chronic autoimmune disorder that happens when your immune system attacks the glands that make moisture in the eyes, mouth, and other parts of the body. It is also a systematic disease, which means it also affects other organs and tissues, thus causing joint pains from arthritis, along with making people tired. This disease affects people of all races, ethnicities, and ages. However, women are 9 times more likely to develop the condition than men. The disease is specifically common among women who are above 40 years of age. Sjogren's primarily targets the lacrimal and salivary glands. The lacrimal gland, also known as the tear gland, is an exocrine gland located above the eyeball. It lubricates, protects, and provides nutrients to the structures of the eye for healthy functioning. Similarly, the salivary glands also play an important role in the digestion because they make saliva. Saliva helps moisten food for easy swallowing. Saliva also helps prevent infection in the mouth and throat, and also produces an enzyme called amylase that makes it easier for the stomach to break down starches in food. For those with Sjogren's disease, both these gland functioning is impaired, causing dryness in mouth and eyes. Researchers do not know what causes the immune system to turn on the body, but they believe that both genetic and environmental factors are involved. Studies have linked Sjogren's syndrome to variants in several genes, many of which are involved in the immunity. Symptoms also vary from person to person but may include dry eyes, dry mouth, fatigue, and joint pain. Sjogren's also cause dysfunction of several organs and organ systems. Individuals with Sjogren struggle with digestive system difficulties such as difficulty eating, acid buildup in the stomach, and dysfunction of the pancreas and the liver, which are essential for the digestion and absorption of nutrients. Some patients also report experiencing brain fog and cognitive difficulties. Although these symptoms have potential to affect nutritional status, the good news is that specific nutrition and diet changes can greatly improve Sjogren's symptoms. Patients need to remember to be proactive in talking with their physicians and dentists about their symptoms and potential treatment options, as early diagnosis and proper treatment are important as they may prevent serious complications and greatly improve the patient's quality of life. The ideal management for this syndrome should really involve a rheumatologist, ophthalmologist, or an eye doctor and an oral medicine specialist, as these 3 medical professionals have expertise in their area and can provide optimal care for patients with Sjogren syndrome. Rheumatologists have primary responsibility for diagnosing and managing Sjogren's and can conduct a series of tests which may include X-rays, referral to PT/OT, and prescribed medications. All medications are used to try to bring the disease into better control. However, these medications can also have side effects and can cause sweating, urinary frequency, and upset stomach. Thus, many patients choose not to take medication and just rely on using artificial tear drops and frequent sips of water to manage the dryness symptoms. Medications are also prescribed to stimulate the production or flow of saliva, along with reducing the inflammation to help joint pain and fatigue. Immunosuppressive medications are also used to treat serious internal organ manifestations. Salivary dysfunction associated with Sjogren's leads to numerous tooth cavities, tooth erosion and loss, and diminished quality of life. Thus, Sjogren patients are asked to visit their dentist at least 4 times a year for dental checkup, along with the use of fluoride salivary stimulants and antimicrobial remineralizing agents. Currently, there is no cure for Sjogren's. However, the disease can be well managed with proper medical treatment and lifestyle changes. Lifestyle changes that may alleviate symptoms include quitting smoking, losing weight if overweight, walking after meals, and sleeping with head of bed elevated, and dietary changes. Avoiding fatty foods and choosing lean protein sources can also improve symptoms. The future of Sjogren's is ever evolving, whether you are newly diagnosed or has been suffering from Sjogren's for years. The Sjogren's Foundation wants to help you continue living your life to the fullest. That is why the Foundation funds and leads a number of research initiatives to help advance our knowledge of the disease. To learn more about the initiatives, please visit www.sjogrens.org. If you like this video, make sure to give it a thumbs up and subscribe to our channel for more educational content.